If you are over 40, you have been telling yourself, I'm just getting older. That's exactly what worries me. Because many of the symptoms people dismiss as normal aging aren't actually normal at all. They are often your body's earliest warning signs that something beneath the surface has begun to change. Ignore them long enough, and years later, they may become the very conditions you wish you had recognized sooner. Today, I am going to show you 5 symptoms I never want my patients over 40 to ignore, because recognizing them early may give you the opportunity to change where your health is headed.
Most chronic diseases don't appear overnight. They often begin years earlier with subtle changes that seem harmless. Less energy, a little more weight, a little less strength, occasional brain fog, and aching joints. Nothing dramatic, just enough that people shrug and say, I guess this is just aging. As a physician, I've heard these words hundreds of times. But here's what experience has taught me. Healthy aging doesn't usually disappear all at once. It fades quietly, one small change at a time.
If you watched my previous video, you know I introduced what I call physician longevity reset. Today, we are taking the next step by learning how to recognize the warning signs your body may be sending. Before disease develops, your body often whispers. This series is about learning how to recognize those whispers while you still have time to respond. Not long ago, someone around the age of 50 came into my office. She wasn't there because of one dramatic symptom. It was several small ones. She told me, Doctor, I'm exhausted all the time. I am forgetting little things. I have gained weight. My knees hurt. And maybe this is just what happens after 40. The interesting part, none of those symptoms turned out to be the real problem. They were clues that her body wasn't functioning the way it used to. And that is an important distinction.
Nearly everyone feels tired sometimes, but persistent fatigue is different, especially when you're sleeping enough. Besides, your cells produce energy every second of every day. When that process begins to struggle, your body notices long before blood work always does. And persistent fatigue can sometimes be associated with poor sleep quality, insulin resistance, loss of muscle mass, low vitamin B12, vitamin D deficiency, iron deficiency, thyroid disorders, or chronic inflammation.
One of the biggest mistakes I see is people accepting exhaustion as their new normal. Now, hear me on this. Fatigue isn't simply about having less energy. It's often your body asking for help. And surprisingly, the next symptom often appears right alongside it.
Now, have you noticed something? Fatigue rarely travels alone. When your body's energy systems begin struggling, your brain often notices next. One of the most common concerns I hear from patients over 40 isn't memory loss. It's something much harder to describe. They simply say, I just don't feel as sharp anymore.
Maybe you have walked into a room and forgotten why. You lose track of conversations. You struggle to find a word you know you should remember. Or, by the afternoon, your brain feels like it's moving through mud. Many people immediately fear the worst. But in many cases, that is not what is happening.
In fact, your brain is one of the most energy-demanding organs in your body. It depends on healthy blood flow, stable blood sugar, quality sleep, regular movement, and healthy communication between billions of nerve cells. When one or several of those systems begin to decline, your brain often notices long before medical tests show obvious disease.
Brain fog isn't something I simply dismiss. It's a signal that deserves attention. Not panic, but attention. In fact, one of our upcoming Physician Reset episodes is devoted entirely to protecting your brain as you age.
But your brain isn't the only part of your body quietly changing. This next symptom is often so gradual. People don't notice it until they've already lost a significant amount of strength.
Let me ask you something. Do you avoid stairs more than you used to? Do heavy grocery bags feel heavier? Do you need your hands to help push yourself out of a chair? Can you still get down onto the floor and stand back up comfortably? These may seem like small inconveniences, but they can tell us a great deal about what's happening beneath the surface.
Guess what? Beginning around the age of 30, adults naturally begin losing muscle mass. Without regular strength training and adequate protein, this gradual decline can accelerate. Muscle isn't just about lifting weights. It's your body's largest metabolic organ. It helps regulate blood sugar, supports balance, protects your joints, and helps preserve independence later in life.
One of the biggest myths about aging is that becoming weaker is simply inevitable. Losing some muscle with age is common. Losing your independence doesn't have to be. In fact, strength is one of the strongest predictors of healthy longevity.
That's why one of the pillars of the Physician Longevity Reset is restoring, not simply preserving your body's strength.
Now, here is where things become even more interesting, because the next symptom isn't just something you see in the mirror. It's something happening deep inside your body, often long before you recognize the health risk it carries.
The next symptom often frustrates people more than any other, because they feel like they're doing everything they used to do, yet their body keeps changing.
This is one of the most common frustrations I hear from patients in their 40s and 50s. They tell me, "Doctor, I haven't changed that much. I'm eating about the same, but my waist keeps getting bigger." If you've ever felt that way, you are certainly not alone.
You see, as we age, changes in muscle mass, hormones, physical activity, sleep, and insulin sensitivity can all influence how the body stores fat. One important change is the accumulation of visceral fat. Unlike fat beneath the skin, visceral fat is metabolically active. It produces inflammatory chemicals that can interfere with normal metabolism and increase the risk of chronic disease over time.
This isn't about chasing the number on the scale. As a physician, I am much more interested in what's happening inside your body than what the scale says. Because sometimes the most important changes are the ones you can't see. That's exactly why we are going to dedicate an entire episode to the physician metabolic reset.
And then there's one symptom. The one many people assume is simply the price of getting older. Joint discomfort becomes more common as we age, but common doesn't always mean something should be ignored.
I have had patients tell me, "Doctor, I just don't do the things I used to enjoy anymore. Walking hurts. Gardening hurts. Playing with my grandchildren hurts." In my view, that isn't simply about getting older. Pain doesn't just affect your joints. It changes your life. It changes your confidence. It changes your relationships. And eventually, it changes how much you move.
As shown here, many people unknowingly become trapped in this cycle. Fortunately, cycles can be interrupted.
Movement, when it's appropriate and safe, often becomes part of the solution rather than something to avoid. Building strength around the joints, reducing inflammation, maintaining a healthy weight, and improving mobility. These are all part of protecting your quality of life.
At first glance, these seem like 5 completely different problems, but what if they aren't? What if they're simply different ways your body is trying to tell you the same story? Not that you're getting old, but that important systems inside your body need attention.
This is one of the biggest lessons I've learned after caring for patients over the years. The body rarely whispers just once. It usually gives us several clues. The question isn't whether your body is communicating. The question is, are we listening? And that's where everything we have talked about today comes together. Because once you understand the pattern, you can begin changing the direction.
For many people, the biggest mistake is treating each symptom as a separate problem. But the human body doesn't work in separate compartments. Your energy, your brain, your muscles, your metabolism, your joints, they are all connected. When one system begins struggling, other systems often feel the effects.
This is why I don't want you to simply ask, what medication can fix this symptom? A better question is, what is my body trying to tell me? This is the reason I created the Physician Longevity Reset. The goal is not to chase symptoms one at a time. The goal is to strengthen the systems that help you stay energetic, sharp, strong, and independent.
Over the coming weeks, we'll break down each of these areas. We'll discuss what changes after 40, what science tells us, and what practical steps you can take to support your health.
Before we finish, I want to give you 3 simple things you can begin today. Your muscles are one of your greatest longevity tools. Prioritize resistance training, even if it's simple body weight exercises. Sleep is not just rest. It's when your body repairs, regulates hormones, and supports brain function. The earlier you recognize changes, the more opportunities you have to influence your future health. If you are over 40, I want you to remember this. Getting older is inevitable, but feeling older before your time is not. Your body is constantly communicating with you. The question is whether we recognize those messages early enough to respond. In the next episode of the Physician Longevity Reset, we are going to focus on something many people fear as they get older: brain fog, forgetfulness, feeling like your mind isn't as sharp as it used to be. If you want to age with strength, energy, and independence, subscribe and join me as we reset the way we think about healthy aging.